A new testing facility for one of the areas of the country worst hit by COVID-19. And a new technology, because the government's second contact tracing app is being trialled here. Although it's not clear it actually works.
What we don't know is the difference the app has made. And that's why I think it's really important for those responsible for running the app. It's not you aren't able to release the data, it's they've got to be the government. Share that data with us, because I'm keen to make sure during this pilot phase we learn the lessons. Otherwise, what is the point of having a pilot?
Those aren't the only questions about test and trace, as our own Kay Burley told the Health Secretary this morning.
I put my postcode in and the website app, and it's 100 miles I have to travel to have a test. That's not satisfactory, is it? That's rubbish, in fact.
It's one of the reasons that we're investing so much more in new testing, and these new technologies can really change that. Because at the moment the system works well. Of course, there's operational challenges from time to time, but it works well. And we're finding a higher and higher proportion of the people in the country who have coronavirus.
But that's not what today's data shows. In the 7 worst hit areas in the country, test and trace is barely reaching half the contacts of people who test positive in the community, so-called non-complex cases. In Blackburn with Darwin, it reaches 47% of contacts, Leicester 53%, and in Bradford just 43%.
The basic problem for the government is that they're very good at contact tracing in places like this, hospitals, where everyone is on hand, but not so good at doing it in the community. And the trouble is that these days most cases are in the community, and that's why test and traces numbers are going down.
Step 2. Chew with your mouth as if you're eating to gather up spit.
The government is pinning its hopes on better tests. Today, it announced 500 million for further trials of a saliva one, and 2 others it says can get results back in 20 minutes.
Carefully pour your saliva into
The Davy family was part of the initial trial.
As soon as we got up, we all came down into the kitchen with our tubes, got our teaspoons out, followed the instructions and essentially spat into a pot. Sealed it back up, and that was it done.
Place the bag containing the pot.
It's a positive step, but it doesn't matter how many people you test if you can't also reach their contacts. With cases at their highest level since May, that will be what's worrying the government. Roland Manthorpe, Sky News.